So the Center for Children and Families has a tripartite mission. We do education, we do clinical services, and we do research. And one of our large educational emphases is on teaching professionals in the community what's important about evidence-based practices and what practices are the best practices to use for children with mental health problems. So this conference is the main way we do that on an annual basis. The Center for Children and Families is pleased to be able to be bringing such an impressive lineup of speakers from around the country with expertise in child mental health.
In addition to covering children's mental health care for various mental health conditions, we're also covering a number of general topics that cut across different child problems. We're addressing racism in children's mental health, working with marginalized populations with histories of oppression, overcoming barriers to care, integrating mental health care into pediatric primary care, and a number of issues along those lines. Another very exciting thing about the conference, we used to hold this conference every 2 years. This is the first year that we've started holding it annually, and in fact, we've had the most attendees ever at this conference.
One of the really exciting and innovative parts of this whole conference is that you really get to see a conversation sparking and happening between those who are on the front lines, really helping kids in their everyday practice, and those who are really researching what are the novel and new types of approaches that we know can help kids get to feeling better and healthier and happier, which is really all of our goal.
It was important for me to present at the conference because I really wanted to share the work that I do with regard to racism-related stress and African American mental health. I hope that from my presentation, people will walk away with an understanding of how racism-related stress affects African American youth. I hope that they'll have an understanding of what are some of the racial and cultural protective and resilience factors that mitigate the negative impact of racism-related stress. And then finally, I hope that folks will have an understanding of how some of these factors and information might be used to inform evidence-based interventions.
I think it's important for Dade County Public Schools to support a conference like this for multiple reasons. One of the most important reasons is for us to collaborate with our community partners like FIU, who do so much in helping us treat families and children that are experiencing mental health concerns, but also for us to learn new strategies and build capacity in our own staff, our social workers, our counselors, our school psychologists that are here.